Room 21. Signed. Committee 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 Room 21, 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 signed. Committee Room 21. 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 Signed. Committee Room 21, 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 signed. Committee Room 21. 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 Signed. Committee Room 21, 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 signed. Committee Room 21. 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 Signed.
Okay, so we are now in public session. So we're moving to item number 5, the draft minutes. Can I refer members to the draft minutes of the proceedings at page, which are at page 77 to 84 of the meeting pack, and ask members if they're content that the draft minutes of our last meeting, 11th of July, are a true reflection of proceedings. Content? Thank you. Next item then is matters arising. No matters arising. So, item number 7, Regulation EU 2024-1860 as regards our gradual rollout of Eudamed, and we have now going to hear departmental oral evidence. So just to let everybody know, this item will be recorded by Hansard, and can I refer members to the relevant papers which are at page 5 to 43 of our meeting packs. Members, we are going to have an initial assessment of impact from the Department of Health, and that is in our pack as well, and that can be found at page 35 to 38 within the pack. And the explanatory memorandum is at pages 21 to 24 of the pack. So can I welcome Brenda McGilligan, Head of EU Future Relations Branch from the Department of Health, if you just want to move forward, and Kevin McVeigh, Head of Life and Health Science Branch, Department of the Economy, and welcome. So
Chair.
I'm just essentially going to hand the meeting over to yourselves to brief us on the regulation. So if you want to fire away.
Thank you, Chair, and good morning, members. Thank you for the opportunity to provide the committee with some background information on EU Regulation 2024-1860. Unfortunately, the Departmental subject matter expert is unavailable today due to planned leave. I am Brenda McGilligan, Head of EU Futures Relations Branch within the Department of Health. My role today is to provide the committee with background information from a health perspective. Along with me is Kevin McVeigh, Head of Life and Health Science Branch in Department for Economy. This legislation amends EU Regulations 2017-745 and 2017-746. Both of these currently apply to Northern Ireland under the Windsor framework. The amendments cover a gradual rollout of the European database on medical devices, also known as Eudamed. They provide an obligation for prior notice of interruptions to supplies and extend transitional provisions relating to the supply of medical devices and in vitro medical devices known as IVDs. Eudamed is already in place and the gradual rollout relates to additional modules of the system. This legislation does not alter the level of risk to supplies of medical devices or IVDs. As members will be aware from a written submission, the main objective of the regulation is to maintain supply resilience within the EU and across member states. It delivers this in three ways: by further extending the transitional period for certain IVDs, depending on the classification of the device, by enabling a gradual rollout of the Eudamed database, and by obligating manufacturers to give 6 months prior notice to member states and healthcare institutions of any interruptions or discontinuations of medical devices or IVD supplies. The use of Eudamed for registering economic operators, devices and certificates aims to improve transparency and provide information on devices present on the EU market. The measures aim to deliver a high level of public health protection within the EU and its member states, including patient safety and avoidance of shortages of IVDs and medical devices. All of these are needed for the smooth functioning of healthcare services. The Department has been aware of these regulations for some time and have been engaging with the Department of Health and Social Care, Department for Economy and the MHRA, known as the Medical Healthcare Regulatory Agency. Through this regular engagement, we share the collective view that applying this regulation should not significantly impact the everyday life of communities in Northern Ireland. I will now hand over to Kevin for DFE's input.
Morning, Committee. Feedback from industry via InvestNI, who's the operational arm of the Department for Economy, has been positive, and we would be in full agreement with Health on the importance of adopting this amendment in Northern Ireland. Brenda has gone through the EU regulation and broken it down into three components. I'm going to look at the two components that impact industry. So the first amendment is relative to further extending the transition period for certain IVDs. The first amendment in relation to this will support businesses transitioning to the new requirements, as manufacturers in both GB and NI will have more time to conduct the necessary conformity assessments, which is important. Secondly, industry understands that the Eudamed system is designed to make the regulatory system more efficient, and this amendment committee will allow the gradual rollout of mandatory modules from quarter 4 from 2025 rather than a full rollout in 2027. Northern Ireland businesses welcome this early adoption. The MHRA advised that they will help to facilitate a smooth transition through proactive engagement with trade associations and business groups to provide clear communication on access and reporting requirements. DFE currently engage regularly with MHRA alongside Health colleagues and InvestNI. At this stage, we're unable to fully determine the financial impacts to adopting this amendment. Although there are no registration costs associated with Eudamed businesses, they may face additional costs in implementing the new system. These will likely be administrative costs. Further investigation would be needed to determine the full financial impact. However, it's important to state at this juncture, by not adopting this Act, there could be economic consequences, as it may prevent businesses being able to supply to EU and NI markets. So members, if there's any questions, we'd be happy to answer.
Thank you both for that. So, I mean, this committee, when it looks at amended or new EU legislation, has two very specific criteria with regards to having an inquiry. One for this point is whether it has a significant impact. So, just given what you're saying, if I can summarise from a health perspective, there's no significant impact, and from an economy perspective, it would actually have a positive impact.
It'd be welcome, yes.
Okay, thank you. Joanne?
Thank you, Chairman. Thank you very much, folks, for your evidence. It's been helpful. Could I just establish, obviously I accept and appreciate that any extension to the timeframe would be welcome, given the vast extent of how this is going to impact, but could I have some understanding of who in the industry was spoken to? If you could tell us that, please. And also, you've said it's likely that any costs would be administrative and further information would be required. What did the stakeholders say about the costs? I mean, are they content with whatever it's going to be regardless? Or, how are they viewing this in a vacuum of not really knowing what it's going to cost?
Yes, thank you for your question. Our arm reach body is InvestNI, and we've liaised with them, and they provided the evidence before the committee this morning. I'm not able to extend any further than that. That's the reach that they have got. I would advise that InvestNI are regularly in contact with industry with these matters and have galvanised their views on this. And obviously, from a finance perspective, this is it's not known at this stage. What I would say is, even taking into account the potential financial burdens to businesses, they are content that that wouldn't be an impediment to the rollout of this.
No, that's fair enough. I kind of just wanted to know if they'd expressed any concern about it. And then I suppose, Chairman, I'm wondering if we've any concept as to the potential extent of the costs, because it may be that industry isn't worried about the costs because they intend to pass them on to the consumer, which could have bearing on health budgets, for example. So just so that we've got a greater understanding as to what's going on within the industry, can you give us any idea as to what the thoughts are around cost?
I'm not familiar. That's the details that have been provided by InvestNI.
Okay, thank you.
Okay, thank you. Owen?
Thank you. Chair, it's just a question in relation to our supply chains for these products. Do we have an awareness as to whether we're more reliant on products coming in from the European market or the GB market? Do we have an idea of?
I'm not familiar with that.
No problem. No, that's grand, Chair. Thank you.
So nobody else has indicated that they want to ask a question. So Brenda, Kevin, thank you very much for coming forward and providing evidence and taking our questions. So committee, under paragraph 8.1 of the schedule of 1998 Act, this committee must decide today whether or not to hold an inquiry into the published Replacement EU Act that has been notified to us. Should the committee fail to decide, the failure will be treated as a decision not to hold an inquiry. So just again, for our benefit, making that decision, we have to have regard to the legal advice on whether it appears likely that the Replacement EU Act significantly differs in whole or in part from the content or scope of the EU instrument which it replaces. And secondly, the departmental initial assessments on whether it appears likely that the Replacement Act would have a significant impact to everyday life of communities here in a way that is liable to persist. So, do members wish to hold an inquiry? David?
Sure, I would propose holding an inquiry largely because of the range of unknowns around the costs for suppliers for MHRA, the uncertainty around the supply chains, which was reinforced by Owen's question there. And I say this not in any way alarmist. I think the first option this committee has always is to hold an inquiry. It's about fact finding. I suspect that the departmental advice will not change, but what it does do is give an opportunity to anyone, in any stakeholder or part of the industry that wishes to flag any concerns to bring them for us. If nothing does come forward and the departmental advice is similar, I suspect the outcome of that from this committee will be fairly predictable. But I do think we have a duty where there is unknowns to at least give the opportunity through an inquiry for people to bring that information or to raise those forward or to raise those concerns as they see fit.
Thanks, Philip. So again, we have a responsibility to ensure that we optimise our responsibility to apply scrutiny to address all of these issues to the greatest extent possible based upon the evidence and the advice that's brought before us. But it has to be done in a proportionate way and in a way, I think, that reflects how we should act based upon what we have heard. And on that basis, I don't think that there's a requirement in this case for an inquiry.
Owen?
Thank you, Chair. And I think we run the risk of conflating two slightly separate issues, because there are questions raised by the original 2017 regulation, and I think that's what David is alluding to. A decision to hold an inquiry would be a decision to have an inquiry into the amending instrument, which is simply just extending the transition period and requiring a duty to disclose any concerns around supply disruption. So I don't actually think the amendment is significant, and I don't think it meets our test for inquiry. Notwithstanding, I understand the concerns around the original act, but I think that horse is bolted in some respects. So I would agree with Declan that an inquiry isn't necessary in this instance.
Okay. So we have two proposals. David's first, that we have an inquiry. I think we'll just take a vote. So can I ask those in favour of holding an inquiry into EU regulation on the gradual rollout of Eudamed to raise their hands, please? So that is Joanne, Stephen and David. And those against? Owen, Emma, Declan and Mahane. So the decision of the committee is to not hold an inquiry. So just moving on to next item of business, which is at item 8, amending regulation EU on mercury as regards dental amalgam and other mercury-added products subject to export, import and manufacturing restrictions. And we're going to hear from the department. So can I just inform members again that this item will be recorded by Hansard, and refer members to the relevant papers at page 44 to 76 of the meeting pack and pages 2 to 21 of the table pack. So within those papers we have an initial assessment of impact from the Department of Health, and that can be found at page 63 to 69 of the meeting pack, and also an initial assessment of impact from the Department of Agriculture, Environment and Rural Affairs, and that can be found at pages 2 to 10 of our table papers. An information note from the British Cabinet Office in conjunction with the Department for Health and Social Care and the Department for Environment, Food and Rural Affairs can also be found at pages 11 to 21 of our table papers. So welcome to our guests, and we have Caroline Lappin, Chief Dental Officer, Department of Health, Michael O'Neill, Head of General Dental and Ophthalmic Services from the Department of Health, Caroline Barry, NEPD, Head of Chemicals and Industrial Pollution Branch in DERA, and Helen Lewis, who's the Principal Scientific Officer and NIA Head of Chemical Compliance within DERA as well. So, Falcha, welcome to you all. I'm just going to hand over to yourselves to brief the committee in whichever way you've hopefully agreed to do so.
Yeah, I have a short statement to make first, Chair, if that's okay. Thank you for the opportunity to brief the committee. You've introduced myself and the colleagues here. Committee members will recall the oral evidence DOH provided on the 18th of April, in addition to 3 documents outlining the Department's analysis of the health-related impacts of the new EU law in question. The most recent of these documents is our completed template provided to you on Tuesday following publication of the regulations. I know the committee are aware of the policy background and the purpose of the proposed regulations, as well as the detail of our concerns regarding their impact. I will therefore be brief in my comments before handing over to Caroline, Barry and Dara. There is no doubt that the direction of travel across the globe has significantly reduced usage of amalgam, and members will note the BDA also articulated that view when they addressed the committee in April. A key concern of ours, however, relates to the proposed timescales and the resultant impact on practices and patients as a result. The Northern Ireland preferred policy position that has been reiterated in recent months remains to phase down rather than phase out. This position was publicly stated in a joint letter to the BDA from the 4 UK Chief Dental Officers in December of last year. These proposals will mean that for the vast majority of our patients, amalgam, which is widely used and an effective material, would no longer be an option. Whilst we already use alternative materials such as composites and glass ionomers, for adults this would generally be only for smaller fillings in front teeth. The Department's concern is primarily in regard to larger fillings in back teeth. In short, we're concerned about the impact, 1, on service capacity, which has not yet recovered to pre-pandemic levels, and 2, the cost to both the taxpayer, which we estimate will be 3.6 million of a budget of around 100 million, as well as a 2.9 million additional cost to patients. It should be noted our cost estimates do not include the fact that the new materials do not last as long, so need to be replaced more often. This total does also not cover the loss or displacement of private fees for white fillings, which the BEA estimate to be in the region of £20 million. An initial bid for this funding was refused by the previous UK government, and whilst we would continue to make the case to Treasury, there are certainly no guarantees that we will be fully funded in the event of the regulations coming into force. In addition to the cost, the composite fillings take longer to place, with an inevitable impact on activity and capacity, at a time when activity levels remain at around 75% of pre-COVID levels. In terms of practice planning, while other member states can plan with certainty now regarding January 2025, uncertainty remains an issue for dentists and patients in Northern Ireland, and we do not underestimate the difficulties that this is causing for practices. So whilst we expect significant impacts in January if the laws come into force, practices are already being impacted in terms of their short and medium term practice planning arrangements. I'll now hand over to Caroline Barry further.
Good morning, Mr Chairman and members of the committee. Thank you for the opportunity to come on here today and provide you with some further background in relation to the new EU mercury regulations and the potential impacts in Northern Ireland. As already noted, I'm currently head of the Dara Chemicals Industrial Pollution team, and I'm joined here today by my Dara colleague Helen Lewis, who heads up the NIEA Chemical Compliance team and is responsible for the enforcement of the current EU mercury regulations under the control of Mercury Enforcement Regulations 2017. As you're aware, DARA has overall policy responsibility in relation to mercury. However, the Northern Ireland Department of Health has an interest and takes the lead in any health-related matters. The EU chemical regulation, the EU mercury regulation, implements the provisions of the Minamata Convention, which is an international environmental agreement with an objective to protect human health and the environment from man-made emissions and releases of mercury and mercury compounds. The UK is also a party to the Minamata Convention and implements the decisions adopted under the Convention domestically. As set out in the performer provided by both ourselves and our Department of Health colleagues, the impacts of the key amendments to the regulation of mercury are different for DARA and for Department for Health. We consider the amendments, which fall within DARA's policy responsibility, to have minimal impact in Northern Ireland. We believe the addition of 6 mercury-containing lamps to Annex 2 of the regulation, which will prohibit their export, import and manufacture from specified dates, will not have a significant impact because of the following reasons. Firstly, in relation to 5 of the lamps specified, the EU is implementing decisions taken at the Minamata Conference of the parties in November 2022 and November 2023. All signatories of the Convention are required to do so, and we understand that DEFRA intend to lay appropriate implementing legislation this year for GB. Secondly, it is already prohibited to import all 6 lamps and place them on the market under the UK regulation as a restriction on the use of certain hazardous substances in electrical and electronic equipment, or RAWs for short, which you may be aware of, for the 2012 regulations. Also, in relation to the manufacturing and export of these items, there's no manufacturing base for them in the British Isles. Furthermore, LEDs or light-emitting diodes alternatives are widely available. And finally, DEFRA has consulted with the Lighting Industry Association and no concerns have been raised. It's also worth noting that the new EU regulations will technically introduce Northern Ireland to GB divergence. The EU amendments place prohibitions on 6 mercury-containing lamps, whereas Minamata and therefore GB place prohibitions on 5. Similarly, the phase-out dates within the EU regulation are 2025 and 2026, whereas GB, following Minamata, will phase the lamps out in 26 and 27. However, this divergence will have little impact for the reasons already stated, and in particular due to the fact that the lamps are already being restricted under UK legislation and they are not manufactured in the UK. The second item in the regulations which fall under DARA's responsibility is the reporting of mercury emissions from crematoria. The EU intend to report by the 31st of December 2029 on the implementation and impact of Commission guidance on abatement technologies for emissions of mercury and mercury compounds from crematoria. We do not consider this to have a significant impact for the following reasons. Firstly, the guidance the UK intends to publish by the 31st of December 2025 is not mandatory. The three crematoria currently operating in Northern Ireland are already regulated under the Pollution Prevention Control Industrial Emissions Regulations in Northern Ireland of 2013 by local district councils. And DEFRA, in consultation with the devolved administrations, has reviewed the UK guidance for crematoria published in 2012. A new updated statutory guidance should be published this year. And this will include up-to-date technical recommendations on mercury abatement, as well as the management of other pollutants such as particulate matter and nitrogen oxides. On this basis, we believe the UK is already in a strong regulatory position in relation to the abatement of mercury emissions from crematoria. Now, I'm now going to hand over to my colleague Helen, who can provide you some further information on the enforcement of the current and new EU mercury regulations.
Thank you, Caroline. Good morning, Mr. Chairman. Good morning, Committee. As Caroline has already mentioned, the EU Mercury Regulation 852/2017 is enforced in Northern Ireland through the UK SI, the Control of Mercury Enforcement Regulations 2017. Regulation 5 lists DARA as the enforcing authority in Northern Ireland. This role is undertaken by NIA, which is an executive agency of DARA. Scoping of how we intend to ensure compliance and carry out enforcement of these regulations with respect to dental amalgam is to commence shortly, and NIA will work collaboratively with colleagues in DARA Policy, Department of Health and other UK and ROI environment agencies to develop this programme of work. In conclusion, if you have any questions regarding the content of the completed pro forma provided by DARA, or in relation to enforcement activities carried out by NIA with respect to mercury, Caroline and I will be happy to answer them. Thank you.
Okay, thank you very much to all of you. Michael, if I could just start with you. In your evidence, you give 3 costs of the impact of this. So 20 million, I think you said, was for displaced private fees, and then you had 3 million and 6 million. Are they yearly costs?
Yeah, they're all annual costs.
Okay, and so if you maybe just give me a wee bit of detail about the 3 and the 6 million costs were for again.
The 3.6 would be the cost to the department. So essentially that accounts for the more expensive materials. So we already provide alternative filling materials. So it includes that. It includes the fact that we're currently paying 30% additional for fillings at the minute as part of the Minister's announcement in March, and it also includes a 15% additional cost to cover the fact that whenever the regulations are in place and the supply of mercury is impacted, there's going to be a likely impact on both the price of mercury and composite materials. So it's by no means an exact science on that, but it's to cover some of the costs around the supply chain issues that may arise. So what it doesn't do is cover the cost of the fact that the fillings last less long, so it doesn't have the kind of longer term impacts on it.
Okay, and in terms of alternate or substitute materials, I mean, is that an immediate issue or a medium to long term issue moving forward?
So if these regulations are in place from January, it's immediately we'll start to face those costs, because we'll start having to pay dentists the higher prices to treat with the more expensive materials, and the time it costs. So it's not just the materials, but it's the additional time. So immediately patients and the department start facing those financial pressures.
And the availability of alternative materials, is that a problem immediately?
We've no indication, Chair, that it will be a problem. So the alternative materials to amalgam that exist are really resin-based materials, composite glass ionomer. Those materials are regularly in use. So we have no indication at this point in time that there will be an availability issue. You would wonder, will market forces play into this in terms of costs as well? So it's really, the 3.6 million is really a bit of a guesstimate as to where we're going to be, because we just had to base it on our like-for-like usage in terms of direct replacement of amalgam with composite or glass ionomer. So it's very difficult to really know what those costs are going to be.
Okay, and I mean, I know we have done this at different times, but I think it's important again to ask the question. So if this piece of legislation is applied, we're in the scenario as you are outlined, if there for some reason the legislation isn't applied here to the north, what does the Department of Health do in terms of reducing the use of amalgam in the immediate term?
Okay. So we're already on our phase down trajectory. We have our national plan in line with the rest of the areas of the UK, and that's around reducing our use. We've already committed, obviously through the UK agreement, to the Minamata Convention, which is based purely on phase down. So we already restrict the use of amalgam. We do not place amalgam fillings in children under the age of 15 or in pregnant or breastfeeding mothers, unless it's clinically indicated that's the only material that can be used. So we've already significantly reduced our use of that. And we would, continue to hopefully keep this going. The other big factor that will help to reduce our overall use of restorative materials, including amalgam, is reducing our levels of decay in Northern Ireland. And there's work underway within the department around how we can possibly speed up the reduction in our level of decay. It's quite difficult. It also reaches beyond just purely dentistry and health. And we will be working with partners around childhood health, working with people around older people's health in general, and all of those would have an impact on the overall oral health of the population.
Thank you. So of three members here, David, Declan and Joanne indicated, so if anybody wants to indicate, just let me know. David?
Thanks, Chair. I was going to start actually with the question that the Chair asked, but just to sort of expand on that, the BDA estimate is at 22 million per annum. Now they say that it includes the displacement of existing private fees for white fillings. Does that entirely explain the sort of discrepancy between the two sets of numbers, would you feel, or is there? Do you think the BDA's working at that is slightly different to your own in terms of the cost, of likely cost?
So that 22 million figure, so that will include all the things we've accounted for and the displacement of the private income. I think there's a conversation to be had as to what extent that should happen and to what extent it can happen, but there's no doubt that the way practices operate in Northern Ireland, it's a mixed, the majority of practices are health service and private, so it's a real issue that they're facing. Yeah. The placement of white fillings is a significant commercial activity for them, so this is gonna have an impact, and I think that's where their main concerns are coming from, is that this is going to have an immediate impact for them in terms of the commercial sustainability of their practices, assuming that there isn't a financial input from the department in that regard.
So it's not unreasonable then to suggest that while your numbers are an accurate guesstimate, insofar as that can be the case, that there will be other and unforeseen costs that may come along for the industry.
Yeah.
Yeah. Thanks very much. Thank you.
Declan?
Thanks, Philip, and thanks for coming along this morning, folks. Could you give us an update on the work, the composition and the progress of the Joint Departmental Working Group, which was tasked with working through any of the issues arising from the amendments?
Yeah. What we've really been doing over the last number of months is identifying the impact. So a lot of that work is inputted into the information we've provided to the committee in the first instance. The next phase of that work will be actually with January 2025 in mind, is looking at, so there will be exemptions under the new regulations for people with medical conditions. So it'll be trying to establish what those should be. You know, in what scenarios should people be exempt from that. The other thing is actually working on the statement of dental remuneration, so that will have to be updated, both to ensure that the fees that are being paid reflect the costs of providing the service, you know, the larger composite fillings, but also in terms of some of the provisos. And so that those are the two main parts of the work. But the work of that group over the last number of months has largely been identifying impacts, and we've been working with DARE colleagues on that, but also engaging with Cabinet Office, Department of Health and Social Care in England as well on that.
Does anybody want to speak from DARE?
Just to reiterate, yes, that's the work the group we've been involved in to date. We're also looking at engaging with some of the other Whitehall departments in relation to access to trade data, which we find would be very useful to help again with our ongoing enforcement activity.
I suppose the other thing that we've, as part of that working group too, is, as well as ourselves and DOH and DARE, part of the membership of that group is also looking at the education and training needs of the profession should this law come in, because there will be some element of additional training around, because we're going to be handling things slightly differently, particularly under health service arrangements, and also ensuring that our university in Northern Ireland that trains our dental students are fully versed and on board on this and the implications of this within their curriculum and their development of students.
So you've anticipated my next question. Therefore, there is a certain amount of horizon scanning going on with regard to either implementation or non-implementation. But respectively, there were different forecasts or outcomes in your presentations. So, what work is being done within the Joint Departmental Working Group to close those gaps? Is there a landing zone? Have you discussed a landing zone? Is that possible? Or does the vagaries of your respective departments simply mean that you can't actually bridge whatever gaps there may be between you?
I would say that the DARE have kind of focused on the environmental side of it and the lamps, and that's, you know, the crematorium impacts. So it's a very different field altogether. So there isn't really a need to come to a settled position in terms of the overall regulations. Basically, part of the regulations we on the health side have a significant impact, and on the lamps crematoria side, DARE's view is that they do not have a significant impact.
Other than to say that if there is implementation of the amendments, that you will continue to work together collaboratively to ensure that we get optimal outcomes and minimum disruption arising from that change.
Yeah,
is that fair to ask?
Yes. Yeah. And that working group is going to be a fixture now, that, you know, working together on that and those regulations.
Can I also say we do work very closely anyway, and this has been a long-term engagement, but it's just this group has now more formalised that.
Thank you.
Joanne?
Thank you, Chairman. Everybody, thank you very much for your evidence. It strikes me that the main problem here is the fact that the EU has brought forward the time frame and to a total ban as opposed to then consideration of a phase down. And I know that you were on that trajectory and you'd taken steps, but it was going to require time. And that was the evidence that you gave us previously. Also previously, what you said to us was that this would have the greatest impact on the poorest in our society. we already have the worst record for tooth decay in the whole of Northern Ireland, and that it was likely then that with spiralling costs, we would see further evidence of people choosing not to come to the dentist to have their teeth issues addressed, because they just simply couldn't afford to do it, and that would be a choice. We're also conscious of the impact that oral health has on general health, and the impact that plaque and so on can have with regard to heart disease. We'd heard previously too, and you've mentioned it again today, about the divergence this would produce from the rest of the UK with regard to qualifications and training. And previously we heard kind of quite dramatic evidence actually from the BDA saying that that all of this, a move to a total ban, and that ban being brought forward as opposed to phased down, could actually result in practices being tipped over the edge, and you've alluded to that today. So thus there'd be massive issues or exacerbated issues within dental practices and availability and capacity within dental services in Northern Ireland. So it strikes me that a lot of this is kind of a no-brainer. But I want to establish, since the last time that we heard from you and the work that is being done as you progress this, has anything happened? Has anything been discovered in terms of your work that indicates things are not as disastrous as had initially appeared? Has anything changed, or are we still going to face massive and significant impact that will be where the poorest in our society will be hardest hit?
I would say in terms, there hasn't been a big change in terms of the input we've provided to the committee most recently and in April. The only thing that has maybe changed is that one of the significant things, and John, you touched on it, was about the time scales, and obviously the practices are operating at the minute with a lot of uncertainty, and so at the minute they're booking in patients for January, February of next year, and there's a question mark as to whether or not what the law will be around mercury. So that's maybe an added uncertainty, but no, there hasn't been any change really in our assessment of the impacts.
I suppose, John, the one thing just to make clear in terms of qualifications and training, I mean, our dental students in Northern Ireland, or undergraduate dental students in Northern Ireland, I think it would be a bit of a stretch to say that their training is going to be markedly different to those across the rest of the UK, or even dental students in the universities in the Republic of Ireland. Discussions with our School of Dentistry lead would say that under the current curriculum, students are taught restoration and cavity preparation for all materials. The difference here would be that they would not be in a position to place the amalgam. They will still be taught cavity preparation for that, so that wherever they would work, they would know sort of the science and the cavity preparation techniques, but they wouldn't have the experience, if this comes in, of actually placing the amalgam. That would be the biggest difference.
Can I also, thank you very much for all of this. Can I just check one other thing too? In terms of the medical exemptions, could you give us some indication as to, well, maybe you don't know at this point, but from what you know at this stage, could you give us some indication as to what the potential criteria are going to be for that? You know, a lot of the time people need this and they've got to jump through a lot of hoops to get it. Or otherwise, maybe it's straightforward. Do you have any indication yet as to what will be required for an exemption, and will it be easy or difficult to achieve?
In all honesty, John, I'm not clear yet as to where the medical exemptions criteria is going to be set. If it's going to be set within each of the member states, which potentially means each member state of the EU could have different exemptions, or whether there's going to be a much more EU member state wide sort of level to be reached. So, for instance, there would be certain medical conditions where it would be quite clear that the use of alternative materials would not be suitable for a patient, or a patient would be unable to sit in a chair for longer, or unable to cooperate for a much more technique sensitive filling placement. But as of yet, I'm not clear as to where that barrier, that level will be.
Okay, thank you very much.
Hey, Joanne, thank you. Owen?
Thank you, Chair, and thank you all for that evidence. So far, just in terms of, I'm sort of wondering, what is the big unique factor that places Northern Ireland in a relatively weaker position when compared to other European health systems? Is it the level of public provision? Is it the level of subsidy that we pay? Is it human resources issues? What is the big factor that I guess is placing us under so much pressure relative to other countries?
I think there are several. You're okay if I go first?
Yeah, sure.
So first of all would be our overall level of oral health in Northern Ireland is not where any of us would want it to be. So our dependency on restoring teeth would be higher than many other countries across Europe. We do differ in Northern Ireland in that we are a very heavily publicly funded system. So across Europe, a lot of dental services are delivered through insurance-based systems. So it's a very different funding model. And then thirdly, the big issue at the minute is around the capacity within our system to actually be challenged by this very quick change, and also the impact of that on a system that's already, the capacity is already reduced from where we were 4 years ago.
I would just add that it's obviously applicable in Northern Ireland from January, but if the same law was being applied across the UK, other jurisdictions would be having very similar difficulties. So whilst the decay levels are certainly pertinent, I'd say that the predominant reason is that just the model that we have and transitioning to something different.
And were this regulation not to apply, and we continued on the phase down trajectory, do you have any concern about security of supply in terms of mercury itself? Because I know a number of manufacturers have either closed or intend to close. Are you concerned about potential cost implications even in that scenario?
I think we would be, because the EU is obviously a very big player in this market. So when they withdraw from that market in terms of the supply of mercury, it's not going to be as commercially viable for the suppliers of mercury. So that's why we start out our statement with, mercury is on its way out. So regardless of this specific law, and Minamata, the Minamata Convention could very well come in with an end date for the use of mercury. So those larger things at play are likely to keep this on the agenda for the coming years.
That's helpful. Thank you, Chair.
Okay, well, thank you.
Back to that, just are we seeing at the minute? I understand, the update in Minamata and everything else could lead to change in this, but at the moment, are we seeing any active steps throughout the UK or evidence that it is being driven down significantly in terms of just my own conversations with those linked to the UK government and so on? Is that there didn't seem to be any immediate will to say, yes, look, we're going to be going along, we're going to align with this, we're going to get rid of mercury, other than to say, well, who knows what will come out of the next Minamata conference. So at the moment, is there any evidence that the UK is seeking to or looking to follow this route, or that we are significantly driving down and actively trying to drive down the use of mercury as it is?
So even on so obviously COVID has impacted the number of amalgam fillings we treat, but even pre-COVID we had reduced our usage of amalgam fillings by 30%, so there was kind of a change there already. The UK-wide policy is basically implement Minamata, so the UK as a nation has been adhering to that, and as and when Minamata changes, it would be to adhere to that. So that would be the kind of overriding. It's not to go beyond Minamata, and there doesn't seem to be a change at UK level at this point to do that.
Thank you.
Okay, thank you. I have no more questions. So once again, I just want to thank the four of you for coming, providing us with evidence and taking our questions. Thank you very much.
Thank you.
Okay, then committee. So under paragraph 8.1 of Schedule 6B, this committee, obviously, as we're all aware, has to decide today whether or not to hold an inquiry into the published replacement EU Act that has been notified. Should the committee fail to do so or decide, the failure will be treated as a decision not to hold an inquiry. So just to repeat, having regard to the legal advice on whether it appears likely that the replacement EU Act significantly differs in whole or in part from the content and scope of the EU instrument which it replaces, and the departmental assessment on whether it appears likely that the Replacement Act would have a significant impact to everyday life of communities here in Alloway is liable to persist. So that's the criteria. I mean, the committee will be aware that given we had sight of this amended EU legislation at proposal stage, we did do investigative work and we have had oral and written evidence from interested parties and that plus the evidence and advice that we've heard today, in my view, does meet the threshold and the tests that are bestowed and the criteria bestowed to this committee for an inquiry. So on that basis, I would be proposing that the committee holds an inquiry into this EU legislation. Declan?
I concur, Philip. Again, when you come back to our criteria, the basis upon which we are bound to make decisions, and in a proportionate way, it makes sense in this case, I believe, for us to convene an inquiry.
Any dissenting voices? No? Okay, so just to inform members that we have now made a decision to hold an inquiry, and if I can therefore ask and refer members to the inquiry timeline at page 72 of the meeting pack. Can we consider and agree the inquiry timeline, which includes scheduling an oral evidence session with departmental officials on the 25th of July, and also want to seek agreement to ask for views on the Act via citizen space survey from the key representatives of business and civil society, and also identified by Reyes at page 73 to 76 of the meeting pack, with this survey having a closing date of the 28th of July 2024. And advise members that the Citizen Space survey will be promoted on social media and that anyone will be able to respond. Also, in line with our agreed procedures, views on the EU Act and its impact on communities here and details of the position in England, Scotland, Wales will be requested from the British Government. Are everybody content with that? Okay. So, moving on then to item number 9, correspondence. Page 89 of the meeting pack is a quarterly status update from Reyes on the proposed replacement EU Act on field inspections and seed productions, Moldova and Ukraine. So at our meeting on the 11th of April, the committee made a decision to monitor the proposed EU Act. Proposal is currently awaiting committee decision in the European Parliament, and there have been no significant changes to date. Everybody's happy to note that. And then at page 92 of the meeting pack is a copy of correspondence from the British Dental Association on the EU regulation, which we've just discussed. It includes a suggested roadmap for action and request a response for the committee. So are members content to note this correspondence, and we will respond to the BDA informing them of our decision today to hold an inquiry? Content? Okay, and just for noting, we also received correspondence from the World Alliance on Mercury-Free Dentistry. We didn't get it till yesterday afternoon, hence it's not included in our meeting pack, but it will be included in next week's meeting pack. So, Chair's business, I have none. Any other business? There is none. Okay, so just to let everybody know, next meeting of the committee has been scheduled for Thursday, 25th of July, 10 a.m. It says here room 30, so if there's any change to that, we will let people know. Adjourn meeting.
Committee Room 21. Sound. Committee Room 21. Sound. Committee Room 21. Sound. Committee Room 21. Sound. Committee Room 21. Sound.